All right, nice job with this. Capture looks really clean. And overall, this is actually a pretty good runner here. So just for everyone else, this is somebody with right-sided hip and lower back pain. And I actually had to go searching a little bit because score is nice and low at 3.59. They're in the Weaver category, which means they're not really getting a lot of collapsing. They're not getting a lot of overstriding. A lot of their mechanics are pretty good if you wind up in the Weaver category. So that's great there. We do see overall lots of green in here. The only thing that shows up really is just a little bit on left side and a little bit at the ankles there. And the ankle is primarily showing up as yellow just because it's a high foot inclination angle at initial contact. And we're seeing fairly high amounts of pronation there too. Otherwise, pretty good, but that's just why we see a little bit of yellow on there, but otherwise pretty good. Now, as far as relating this back to right-sided symptoms or right-sided lower back pain. This is somebody that I'd really be interested in seeing what their runner readiness assessment looks at. And I had to go dig in a little bit deeper here because not a lot stands out. Actually, the right side has less adduction and rotation than the left. So you could be suspecting a little compensation for the left side, just seeing a little bit more trouble with that. Ground contact time's a little higher on that side, but this is somebody trying to get back to running. So overall good. So what we had to do actually was go into the graphs to look a little bit more. And the first graph I want to actually look at here is pelvis angles. And this is why I said I wanted to look more at the runner readiness assessment here, because we look at this and this is pelvic rotation. So we came into the graphs down here, we opened up pelvic rotation, and you see that this person never really gets into left forward pelvic rotation except for like maybe once or twice. And it actually is a little later in the cycle than we would want to. At initial contact, we would want the pelvis to be kind of rotated towards the side that's landing here. And we're seeing that there's a limited amount of pelvic motion. So because of the right-sided nature of that, I would really look at what do they look like for hip mobility? So what does their back bend look like? Could there be some hip stiffness and pelvic stiffness? What do they look like on the unilateral hip bridge endurance test to see where they overall for rotational stability? And this is one that you have to remember that running might be viewed as a linear sport, but there is rotation involved and there's a lot of derotation and a lot of activity there. So this is another person I would also, from a cueing, from a gait standpoint, I would look at their arm swing a bit more too, just to see if they're having a nice aphasic gait. Is there a lot or limited arm motion? This is a way that you can kind of cue some of that pelvis. And that's where I might look from a standpoint of actual form and technique changes, but I would be looking at as well just to run a readiness and look at some of their mobility, pelvic control. Can they do some pelvic tilting, borrow some exercises from golfing, and then get them back on the treadmill and see if they can just increase the arm swing and see if they can get that pelvic rotation to be a little bit more symmetrical and even there. That could be a motor control issue or a mobility. We don't really know without the runner readiness assessment, but a nice capture and an interesting case here. So those are some things that I would try in this situation.